Most people still think dental imaging centers are diagnostic facilities, places where patients just go to take radiographs or CBCT scans. But I believe they are becoming something much bigger. Underneath the surface, a much larger transformation is beginning to take place. Dentistry is slowly moving from isolated clinical workflows to connected digital infrastructure. Hi everyone, my name is Dr. Robert Appel. I'm a retired orthodontist and I spent more than 25 years in clinical dentistry. Over time, my interests evolved beyond treatment itself toward diagnostics, craniofacial analysis, radiographic interpretation, occlusion studies, and the technology behind modern dental imaging. Today, I want to discuss a structural shift happening in dentistry and why dental imaging centers are increasingly becoming infrastructure assets rather than just clinical services. Over the last few years, I've been observing this transformation or this transition very closely, and I believe most of the industry is still underestimating its impact. Dentistry is quietly moving from a procedure-based industry to a data-driven infrastructure industry, and dental imaging centers are becoming central to that transformation. What used to be a simple diagnostic step, taking a panoramic radiograph or a CBCT scan, is now evolving into an entirely different category of business. Because modern dentistry no longer runs only on procedures, it runs on data. CBCT imaging, intraoral scanning, AI-assisted diagnostics, digital treatment planning. These are no longer isolated technologies. They are becoming interconnected systems. And those systems are increasingly driven or driving clinical decision-making, which changes the economics of dentistry completely. But here's something many dentists still misunderstand. Owning a CBCT machine does not automatically create a profitable imaging business. In fact, in many practices, expensive imaging equipment becomes an underutilized asset sitting inside a single office. Low utilization, high fixed costs, limited scalability, and operational inefficiency. What many clinics are discovering is that digital workflows are becoming increasingly complex, not only financially, but technologically. Today, dentistry requires imaging, software integration, STL and DICOM management, AI analysis, implant planning, surgical guide design, and digital collaboration between providers. That is no longer a simple radiology workflow. It is becoming a technology infrastructure workflow. And this is where the real opportunity begins. The opportunity is not simply owning imaging equipment. The opportunity is centralization. A modern imaging center can function as a shared digital infrastructure hub, serving orthodontists, implantologists, oral surgeons, prosthodontists, and multi-location dental groups. Instead of every clinic purchasing expensive equipment and building internal digital departments, a centralized center can provide CBCT acquisition, intraoral scanning, treatment planning, AI-assisted analysis, and surgical guide workflows, and ready-to-operate digital cases. This creates a much more efficient model. And in healthcare, efficient infrastructure models tend to scale very well, because the economics are driven by utilization across a network, not by the production capacity of a single doctor. This is one reason investors and dental groups are beginning to pay attention to this sector. Because once imaging becomes centralized, the business starts behaving completely different. It no longer behaves purely like a traditional dental clinic. It starts behaving more like a healthcare infrastructure. And infrastructure businesses have very different characteristics: recurring demand, network effects, scalable workflows, operational leverage, and high long-term strategic value, especially as dentistry becomes increasingly digital over the next decade. What's interesting is that we are still early. Many dental practices are only beginning to adopt digital workflows, AI diagnostics, guided implant surgery, and cloud-based collaboration, which means the infrastructure supporting that transition is still being built. And historically, infrastructure layers often become some of the most valuable parts of an industry. In upcoming videos, I'll break down how imaging centers actually generate revenue, what the real cost structure looks like, how digital workflows increase profitability, and why this model may become one of the most interesting opportunities inside modern dentistry. If you're in dentistry or if you're interested in healthcare innovation and long-term investment trends, this is a transformation worth watching closely, because the technology is evolving rapidly, but more importantly, the infrastructure is still being built. In my next video, I'll explain the hidden business model beginning to emerge behind digital dentistry and why connected workflows may be changing the structure of the industry itself. Thank you for watching, and I'll see you there.